In this segment on hypertension, I'm going to tell you more about this silent killer. Believe it or not, a lot of times hypertension has no symptoms. For most patients, high blood pressure is found when they visit their doctor. But since most black folks don't go to the doctor, we get symptoms. Please get your butt up off the couch and go to the doctor at least once a year. Because sometimes there are no symptoms, people can actually develop heart disease and kidney problems without even knowing they have high blood pressure. But here are some of the symptoms to look out for. If you have a severe headache, nausea, vomiting, confusion, changes in your vision, or nosebleeds, you may have severe high blood pressure, so you gotta get it checked out immediately. So what are the tests for hypertension? Your healthcare provider will check your blood pressure several times before diagnosing you with high blood pressure. It's normal for your blood pressure to be different depending on the time of day. Blood pressure readings taken at home may be a better measure of your current blood pressure than those taken at your doctor's office because you get white coat hypertension. You get nervous at the doctor's office. Can I get an amen on that? Make sure you get a good quality, well-fitting home device. It should have the proper size cuff and a digital readout. Your doctor will do a physical exam to look for signs of heart disease, damage to the eyes, and other changes in your body when you go to the doctor's office. They may also look for high cholesterol levels, heart disease, and kidney disease. So how do we treat this monster? Well, the goal of treatment is to reduce blood pressure so that you have a lower risk of those complications I mentioned. You and your healthcare provider should set up a blood pressure goal for you. If you have prehypertension, your healthcare provider will recommend lifestyle changes to bring your blood pressure down to a normal range. Medicines are rarely used for prehypertension. You can do many things to help control your blood pressure at that point, including eat a heart-healthy diet, including potassium and fiber, and drink plenty of water, and exercise regularly, at least 30 minutes of aerobic exercise a day. That does not mean the exercise of lifting your fork to your face, okay? If you smoke, quit. Find a program that will help you stop and limit how much alcohol you drink. 1 drink a day for women, 2 a day for men. Limit the amount of salt you eat. Aim for less than 1,500 milligrams per day. That's 1 teaspoon, folks. Reduce stress. Try to avoid things that cause you stress. And you can also try meditation or yoga. That's right, black people do yoga. Stay at a healthy body weight. Find a weight loss program to help you if you need it. There are many medicines that you can actually use to treat high blood pressure. Often, a single blood pressure drug may not be enough to control your blood pressure, and you may need to take 2 or more drugs. It's very important that you take the medications prescribed to you. If you have side effects, your healthcare provider can substitute a different medication. If you're a black man, try to avoid a class of medicines called beta blockers because they generally don't work as good for us. I'm your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.